Today we will talk about urinary tract infection or UTI. I am Dr. Mohammad Rafiqul Islam. I am a Registrar of Medicine in Recurrent Medical College Hospital, Dinajpur. So what is UTI? It simply means the urinary tract infection. It affects 1 to 2% patients in primary health care, and it is accounting for 1 to 3% of consultations in general medical practice. It is common in women, and half of all women in lifetime experience it. It's uncommon in men except the extreme of age, that is first year of life or over 60 years. What is the etiology and pathogenesis? The common etiological organism is Escherichia coli and other coliforms up to 70%, and other organisms are Proteus species, Staphylococcus saprophyticus or epidermidis, Enterococcus faecalis, Pseudomonas species, Klebsiella species. So what is the pathogenesis? Urine is an excellent culture medium for bacteria. Infection is usually ascents up the urethra. Short urethra in women causes easy ascent of the bacteria, and rarely from the bloodstream or lymphatics can cause urinary tract infection. There are some risk factors we have to know. First of all, female gender, especially postmenopausal women, new sexual activity, particularly in young women, indwelling urinary catheter, which is an important risk factor for urinary tract infection, or instrumentation of urinary tract stones. Urinary tract stasis, such as incomplete bladder emptying, some immunocompromising conditions such as diabetes mellitus or immunosuppression, dementia. What are the spectrum of presentation of urinary tract infection? This is very important to know. UTI, that is urinary tract infection, can be present with asymptomatic bacteriuria, that is there is culture positive but no symptom. Symptomatic acute urethritis and cystitis. It may be present with acute pyelonephritis, acute prostatitis, or it may be present as septicemia, especially due to gram-negative organism. What are the clinical features? We can divide it as cystitis or lower UTI and as pyelonephritis or upper UTI. So what are the features of cystitis or lower UTI? There will be frequency of micturition by day and night. There is urgency, that is immediate urge to pass urine. Dysuria, that is painful voiding. There may be suprapubic pain and tenderness. There may be strangury. What is strangury? Strangury means that you go to void, but after voiding, there is sensation of incomplete voiding. There may be hematuria, microscopic usually, but gross hematuria can also occur. Smelly urine. What are the clinical features of pyelonephritis or upper urinary tract infection? Fever, loin pain, renal angle tenderness. These three are called the triad of pyelonephritis. Other features may be vomiting, systemic unwell, and hematuria can occur. What are the common investigations should be done? Complete blood count with ESR. Complete blood count may show neutrophilic leukocytosis, and ESR may be raised. Urine routine examination should be done. Also typistic test. In urine examination there may be number of pus cells per high power field. Usually in urinary tract infection there may be plenty pus cell. We should send urine for CS to confirm the diagnosis by which organism it has occurred, and also that can modify our treatment, and we should start treatment after sending the sample for CS. Serum creatinine should be done. What is the condition of the creatinine? It may modify our treatment. Also, urinary tract infection itself can cause acute kidney injury, so we have to see the condition by serum creatinine. And also we have to search etiology by doing ultrasonogram, plain X-ray QB. In special situation, there are indication of CT scan, MRI and nuclear imaging. So how we confirm the diagnosis? It is based on the culture of clean catch midstream specimen of the urine and the presence or absence of pyuria. There are some criteria for diagnosis of urinary tract infection. If the patient is woman and symptomatic, then more than or equal 10 to the power 2 coliform organism per milliliter of urine plus pyuria, that is more than 10 white blood cells per cubic millimeter, or 10 to the power 5 or more of any pathogenic organism per ml, or any growth of pathogenic organism in urine by suprapubic aspiration. In case of men, the number of pathogenic organism, that may be any pathogenic organism more than 10 to the power 3 or more per ml, and in asymptomatic patient 10 to the power 5 or more pathogenic organism per ml of urine on 2 occasions, which we call asymptomatic bacteriuria. So how we can manage? We should start our treatment when we suspect urinary tract infection after sending the CS. In case of single isolated attack, trimethoprim sulfamethoxazole can be started. Nitrofurantoin 100 mg twice daily dose for 5 to 7 is commonly used. We can use single shot treatment with 3 gram of amoxicillin or 1.92 gram of cotrimazole in the patients with bladder symptoms less than 36 hours. Other options, that is second line treatment, fosfomycin 3 gram single dose, ciprofloxacin 500 mg 2 times daily, or levofloxacin 250 mg 2 times daily can be used. A high fluid intake, that is at least 2 liters daily, should be encouraged. If pyelonephritis, then there should be IV antibiotic, ciprofloxacin, gentamicin, meropenem or others. So what is the management of recurrent infection? Recurrent infection may be 2 types, relapse and reinfection. So what is relapse? Relapse means recurrence of bacteriuria with the same organism within 7 days of completion of antibacterial treatment. In this case, we should search for a cause such as stones and treatment modified if possible. Intense or prolonged treatment may be required. If all fails, long-term antibiotics are necessary, such as nitrofurantoin 50 mg daily. Reinfection, bacteriuria absent after treatment for at least 14 days or longer, followed by recurrence of infection with the same or different organism. It implies that the patient has a predisposition to periurethral colonization or poor bladder defensive mechanism. Use of diaphragm or spermicidal jelly should be discouraged. Atrophic vaginitis should be ruled out, and preventive measures should help the patient. What are the preventive measures? These are very important for urinary tract infection patient. Fluid intake should be at least 2 liters per day. Regular complete emptying of the bladder. Good personal hygiene should be maintained. Emptying of the bladder before and after sexual intercourse. Cranberry juice or tablets may be used. Evidence of constipation. Voiding should be done at 2 to 3 hour interval with double micturition if reflux is present. Asymptomatic bacteriuria We have defined it, that is more than 10 to the power 5 organism per ml in the urine of asymptomatic patients, and should be done in 2 occasions. It does not need treatment normally, but treatment should be given in infants, a pregnant woman, and those with urinary tract abnormalities, also in the transplants patients. Catheter-related bacteriuria. Bacteria is common in catheter insertion or catheter or instrumentation. Bacteriuria increases the risk of gram-negative bacteremia 5-fold. If asymptomatic, then there is no treatment. And the important thing is that when we do a catheter of a patient, that is indwelling catheter, should be done with a sterile method. That is, sterile catheterization can prevent it. So thanks for watching.